You are listening to the Nottingham Recovery Network podcast, where we tell true stories of people who've walked the path of recovery and hear from those that supported them every step of the way. Real people, real recovery, real hope.
Welcome back to another episode of the Nottingham Recovery Network podcast. Today, we're really lucky to be joined by Lou Wilkins from the Health Shop. Lou's the team leader at the Health Shop, which is based in Notts City Centre. Hi, Lou.
Hi.
So thanks for coming in and talking to us. We've been talking to lots of people from lots of different services, and some are more frontline than others. And I guess the Health Shop is maybe the most frontline service that we've got.
I'd say so, I think.
So tell us a bit about what the Health Shop does primarily.
So kind of basically, I guess the Health Shop provides a range of interventions to reduce risk associated with drug use or sexual health, really, more than anything. So we provide a variety of things like needle exchange or testing or condoms, lubricant, oral dams, anything really that can help prevent kind of a variety of things that might happen.
And when you say a needle exchange, to those who don't know, well, what's the purpose of a needle exchange and why might people come in for that?
So for a variety of reasons. So fundamentally, the idea behind it is that people can collect new equipment and use that and then return their old equipment. So that prevents. So originally needle exchange was a setup at the early 80s, early 90s as HIV was starting to emerge in the UK. So the first needle exchange was in Peterborough and then Liverpool. I'm not sure when Nottingham started, but they've been around a long, long time. So fundamentally it's about that exchange process, but needle exchanges are far more than that. A lot of people we see face health inequalities. It's an access, it's a very, like you say, frontline access to services without any kind of thing that people have got to stop doing anything, really. So for us, it's not about someone has to want to stop using drugs to access our service, about meeting people where they are. We don't condemn or condone anything. It's just that, what does someone need when they come? What can I do to help, really?
And so I guess that goes into a lot of the harm reduction stuff, doesn't it? The needle exchange, old equipment or sharing equipment can lead to a lot of complications and blood-borne viruses and stuff. So one of those blood-borne viruses is Hep C, and you guys did a massive project around that?
Yes, we were part of the England's ambition to eliminate hepatitis C within drug and alcohol services nationally. We were one of the first services in our local area to do that, which was a huge achievement. I think because we did have higher levels of hepatitis C compared to maybe some other areas, just to do with prevalence rate more than anything, really. And that again goes back to that health inequality side of things. It's not that someone's done something wrong, it's just the amount of viruses in an area, really. So yeah, the team worked really hard within the Health Shop, but also wider partners within NRN and Kinsay, Share Care, coming together, working really proactively with service users to improve their health, really. No one should be living with hepatitis C in this day and age.
So with hepatitis C, what physical health implications might someone see from that, and what's the treatment look like for that?
So hepatitis C is quite an interesting virus, really, because people can be exposed to it and not know they've got it for over 30 years without having any kind of physical signs at all, really. People talk about feeling kind of tiredness and achiness, but if you think about a lot of our service users who may be homeless, vulnerable in some way, in withdrawal, for example, those signs sometimes can be missed. And if it's left untreated, people can die from liver-related cancers and other things as well. It is horrible. So we think that no one should be living with it. There is effective treatment that's just a tablet-based. You take a tablet for 8 weeks and side effect free, and people are clearing it really easily. So there was some older treatment that wasn't very nice, that was quite complicated to take, had a lot of side effects, but the new treatment is absolutely a game changer. And we actively treat people who are still using drugs, people who are homeless, people who are drinking. There is nobody that cannot have hepatitis C treatment. So I guess in that sense, if anybody's ever had any risk, even one risk, 20 years ago, we'd encourage anyone to get tested. It's the best way to know. You can be tested very easily, just with a simple prick of the finger. And there's lots of people there to support anybody through treatment. So yeah, nobody should be living with it in our kind of day and age, really.
And that's no small achievement. Like, to have everyone in services either clear or being treated for hepatitis. How many was it?
Oh gosh, we've treated hundreds of people. It's a phenomenal achievement. And I think because of the levels of S&D in our city, I think there's that presumption that only certain people will get through treatment. So we've got a really good partnership with hepatology teams. So we get given the medication to take out to people. So rather than expecting someone to remember that every Tuesday at 2:00 they've got to see a nurse to get given a tablet, we can take the medication to where they're living, whether that's, in a tent or in a hostel or on the street. We had a guy that used to come in every single day and collect his Hep C tablet, and he used to have a cup of tea, and if he needed a dry pair of socks and checking he was okay, and he successfully cleared with treatment. So it's really easy and accessible.
That's amazing. Just going back to the needle exchange thing, how does that work? So if someone's using, they can just come in and
Yep. So no appointment, like you say, is very front, like literally our door is always open, you walk straight in, and then there's someone ready to greet them in reception, and depending on what substance they're using. So we have separate assessments depending on the different types of drugs that someone might be taking. So for example, if someone's using heroin, we do a specific type of assessment. If someone's DIYing as part of gender affirming care, it might be slightly different. Someone using steroids, it'd be different again. So we take them into a room and go through some questions, make it really easy and relaxed. We don't ask for proof of name. So again, we recognise that there can be a lot of stigma faced by people that take drugs. We want to make it easy for people. If people just want to give a little bit of information, start off with, that's what we'll do, and build that relationship and trust with somebody. So they always leave with something, and they can choose to take a little bit or enough, for a few days or a few weeks, depending on what they need. So we've got a wide range of equipment that's suitable for all different drug types and different parts of the body where someone's injecting as well.
So working on the front line, I've done it a bit myself, and I know that some of our service users are quite hard to engage. How do you start those relationships, and how do they develop, and what do they develop into?
So I think we're lucky in the sense that we're giving people things that they want. So I think that relationship is quite easy to build initially. And also when people come, for example, needle exchange, we do offer a drink, and we've got homemade cake available and a dry pair of socks downstairs. And that goes a long way to build that relationship and trust. And then I think as people get used to us, then they'll give us feedback. So for example, if the equipment changes, or we've got a new leaflet we're trying to write, people will tell us what they think. People never usually shy to tell us if something's really good, or the cake's rubbish, or the squash is too strong. We really listen to service user feedback. It's really, really important. And service users become involved in stuff. So we've got an amazing team of peer naloxone workers. So these are service users with living or recently lived experience who are trained and are paid the same. So they get paid to do their work, and they go out in the community and they take naloxone to their peers and engage in a way that maybe staff can't do. And then they come on to other things, so they'll give feedback on training. They're part of different groups that we run. They're incredible. So that's one group. But again, because like I was saying, our service user group is so diverse, different people will give different feedback on different things. So so example, the DIYing booklet that a colleague wrote, we got loads of feedback on that, because we want to make things useful and relevant and appropriate to people. So we can't be experts in everything, but our service users are, so why wouldn't we listen to what they have to tell us, really?
You mentioned naloxone. Do you guys give that out at the health shop, and what's the importance of naloxone being around?
So naloxone is a life-saving medication that reverses overdoses from substances like heroin or tramadol or codeine, nitazine, fentanyl, those kind of substances. So we've been giving out naloxone for over 10 years in the city. So the health shop was part of a working group amongst other services when it first came to Nottingham. So the health shop give it to people that need it, whether that's someone who is using heroin, whether it's a family member or a friend of someone that uses substances. And we also do the staff training for people in the city as well. And it comes in two formats, so either injectable version called Prenoxide or a nasal version called Nixoid. And we're trying to work with partners to kind of get as much out there in the community, because naloxone only works if it's in the hands of people who need it when they need it. So the idea is people can have it anywhere, and then they can use it to either save a friend, a partner, a loved one, a stranger.
Sexual health is something you mentioned.
Yeah.
So the sexual health services, again, I guess there's some thought around BBVs and stuff around that, but what services are offered in and talked about?
So from a sexual health point of view, this is why we are different, because, there's lots of elements of services, aren't there? But we are very much harm reduction for everything, really. So from a sexual health point of view, we are set up to work with people who face health inequalities or disadvantage or are disproportionately affected by poor sexual health in different ways. So like through STI testing, and we don't look at body parts. So if someone's been subjected to some kind of trauma or they've got gender dysphoria, so we don't look at body parts, so people can take their time. We do self-taken tests for chlamydia and gonorrhea, and then we can do either venous samples or self-taken venipuncture or finger prick tests for things like HIV, hepatitis B, C and syphilis as well. And then we can treat for various STIs, and we refer on to partner agencies to make it, again, really easy for people. We give contraception. So the nurses provide Depo-Provera injection. And again, through the Access Project, which I'm sure we can probably talk about at some point, we can support women to access a choice of contraception that meets their needs as well. We've got lots of different types of condoms. So we've got big ones, thick ones, thin ones, flavoured ones, latex-free ones, all sorts of different types. We do oral dams. We do internal condoms and also gloves and lubricant as well. So a vast selection of condoms and other products that people can take.
Sounds like you got everyone covered.
Literally.
Yeah. So the Access Project, as you mentioned, that's fairly recent.
Yeah, relative. And I think what this does, I think it shows the team. I think I always say anybody can give needle exchange or give condoms to people. It's literally a transaction. But what you can't teach is that, I'm going to say soul, I know it sounds cheesy, but it really is like that ethos that someone has, really, I think, to work in harm reduction. So all the team have different areas that they really push and stress depending on what they're interested in. And one of the nurses was really passionate about women's health, recognised a gap for women. And I think there was a perception that women didn't want stuff. If they wanted it, they'd go. Women don't engage. There's nothing really that need kind of thing. I think what that nurse has done is prove that women do want contraception, and they want it in a place that is safe and supportive and understands trauma and experiences of women with severe multiple disadvantage. So the Access Project provides this either directly at the health shop or on outreach or at one of the monthly clinics that happen at Victoria Health Centre, where a team of nurses and doctors, HAs and receptionists are there just for our women. So the women can go and feel supported. They're not judged or stigmatised. They get food and clothes. They get somewhere to change before they have examinations. It's really beautiful. It's such a lovely, supportive, trauma-informed kind of outreach. And then we also do lots of outreach in the daytime, but we would do it really late night outreach from 8 to 11 on a Wednesday evening. So we'll go and see women who may be on-street sex working and take services directly to them as well. So I think it smashes that kind of narrative that women don't want. Women absolutely want. They just want it that meets their needs in a place to feel safe.
I think that's something everyone in NRN sort of looks at, removing barriers to treatment. It sounds like you guys are actively doing that all the time. The other service, but we haven't mentioned, is the health bus. I've been out on a health bus a couple of times with our friend Dobbo. It's a bit like being in the A-team, isn't it? You slide the doors open and bust out the back with a load of really good services. Tell us about the bus and how that came about.
Oh, so the health bus is amazing. So that's made a huge change actually to our service. So it came about because we used to borrow Pal's bus a long time ago, and because they use it in the evening, and we borrowed it a few times in the daytime and realised how good it was. Recognising that everyone comes into the city, and actually it's quite hard to get into the city sometimes financially and time-wise. So we've got a health bus, which Framework very kindly pay for us to go out. It's a clinically fitted old ambulance. What I really love about the health bus is it's got no logos on it. So if someone, doesn't really like the NHS or Framework or the health shop or something at one point, they're not going to be put off by going on it. And also we're going with partners as well. So we go out with the homeless team, we go out with Changing Futures, we might go out with staff within like RASDAC, for example. So everyone's equal on the bus as well. It's like everyone goes on together. So the bus goes out in the community, and anything we can do from the main base of Broad Street, we can do in the community. So it's clinically safe. It provides a point of safety. So if it's not safe or maybe clinically safe to go into someone's home or where they're living or stopping, they can come on the bus and we can take blood, we can do fibre scans because it's got electricity, we can give out condoms. Someone can safely disclose, for example, if they're subject to domestic or sexual violence, we can do dash wicks on the bus. So yeah, it's it's changed the way we work because we're taking services to people rather than expecting them to come to us when that's not always easy. So it's amazing. We love it.
In terms of like the different communities you serve, you mentioned like some people might be homeless, or I guess you see people from all walks of life coming.
Yeah, we are a very, very diverse service, which I'm really, really proud of. And I think, like I say, the staff will champion different community groups and different service user groups, either because they've got lived experience directly or they know people or they're from that community. So, one of the things, for example, the most recent innovations around DIYing. So people who are self-sourcing hormones as part of gender-affirming care. My colleague recognised there was not really any harm reduction information out there, so she wrote something for people who were self-injecting hormones. And again, to me, that's so important, because why should advice be able to be given to one person who uses one substance, but there's nothing for somebody else? If you inject a drug that's not prescribed, then we should be giving you harm reduction information and access to equipment that meets your needs and that's not going to cause someone damage, really.
I guess it's the realisation that people are going to do stuff that isn't necessarily healthy for them, but giving them the option to do it in the healthiest way, that's a big part of it.
Yeah, I think people take drugs for a reason, don't they? And I think for me, that reason is different depending on the individual and the type of drug that person's taking. So whether it is an anabolic steroid, whether it's melanotam, whether it's estrogen because someone, is transitioning, whether it's heroin because that blocks out, obviously, the motion, physical pain, whatever that substance is, people should have equal right to harm reduction, really, shouldn't they? It's not about us to say why. And I agree with you, Richard. I think it's that, giving people equipment doesn't make them take drugs. People are going to take substances, whatever. People have done that for hundreds of years, and when I've gone, they will continue to take substances because people take drugs, don't they? So for me, it's about providing that to keep people safe. One of my friends who was a service user advocate, he said, dead people don't recover. And I think that's, so important. And recovery for me isn't everything, because I think some people choose to continue to take drugs and they are just as valid as someone who decides to stop taking drugs. I wear a T-shirt sometimes that say nice people take drugs. And I think there's so many things around stigma, and it's so important, I think, to give people what they need, really.
I think the stigma is something all services come up against, not just in terms of the service users coming up against stigma, but I know the health shop sometimes do a bit of out-of-the-box thinking, and has that sort of brought any backlash? I'm thinking about a crack pipe project that you had. I
think we've faced backlash over so many things. I feel like we've had stuff to do with transphobia. We've had stuff, pride around homophobia. People don't understand around DIYing. We stand up for our service users who are shouted at in the street by people who maybe are homeless or using drugs like heroin. I think every single one of our service users faces some kind of stigma at some point, and it's our job to advocate for that. So the pipes, I think, are in a good example. So I've been trying to give out crack pipes for about 15 years at the health shop, but they are illegal to give out because of the way that the laws are around paraphernalia, for example. But we're looking to be part of a pilot, a research project, which allowed us legally, with support of the police, to give pipes out to people. And what these pipes do, they're in a harm reduction intervention in their own right. So again, giving pipes out doesn't encourage someone to take crack. People are taking crack already, but they're using really unsafe equipment, plastic bottles, asthma inhalers, bits of, metal bolts, Brillo padders, gauze. So all these things cause quite serious issues for people. So to give pipes out is a harm reduction measure in itself. But what that does, it opens a door to people that are underserved. So people that use crack don't always come into services. They miss out on the same services that other people are entitled to. So if they come to the health shop for a pipe, we'll ask if they're all right. We'll ask if they need any food, where they live in, what their mental health is, what their breathing's like, if they need STI testing. So I think it kind of, that inequality then becomes more equal, I think, in that sense. So the pipes have been fundamental. They've changed the way that we work. It's been incredible, but we had to push for it. It wasn't easy. And I think if the health shop had given up at their first no, it wouldn't have got past 1985, I think. So I think we've always pushed stuff. We've always challenged. We've always asked. And if someone said no, then we've gone back and tried again. So
it's kind of mad, the legalities around that. Like, drugs, you can give out needles. You can't walk down the street without seeing a vape shop with a load of bongs in a window, but you can't give out a pipe that's going to reduce transmission of bloodborne viruses, and like it's cleaner, there'll be less carcinogenics in it.
And it's the engagement in services, isn't it, I think, as well. And you're totally right. I think the law's a funny thing, isn't it, I think. So, yeah, I think it's fundamentally huge for Nottingham. I think the fact the police have supported it, it's incredible. We're very lucky, I think. And I think we've not always been that lucky with police, but the force we've got at the moment and the specific staff that we work really closely with are really good. They are very harm reduction focused. And I think they've seen the benefits. So they've seen the pipes being an engagement tool. We've got people in treatment as a result of the pipes. We've got people tested for hep C because of the pipes, naloxone because of the pipes. So it's huge. It's massive, but yeah, it doesn't make sense to me. But hopefully the law might change and other services that maybe are struggling and don't have the same support from the commissioners from framework, for example, and the police may be going to give pipes out in their area as well.
Does the sort of recent changes in our political environment around Nottingham have any effect on you guys?
So it definitely has in the past. I think when harm reduction came off the agenda, it really, really affected us. So our service was massively cut, like hugely cut. So the health shop closed its doors for a little while, and I kept the health shop sunny sign in my garage for 1.5 years, hoping that at some point I could get to put it back up again. And I think we have. But politically, harm reduction is a real big thing. So yeah, it makes a huge difference to us what happens and where the agenda kind of set, really.
Well, watch this space, I guess, isn't it? What about, some success stories that you've had? Because they're the things that keep us coming into work every day, I think.
Yeah, so the success for us is I guess there's so many things, I think. It's someone coming for the first time and coming back as a success. It's someone who maybe, is injected in somewhere that's really risky and really unsafe to find somewhere that's safer, or moving maybe back to smoking, for example. It's somebody who clears hep C that would never have been expected to do that, like written off, like they're never going to get through hep C treatment, and they go through it. Sometimes our success we never see. I sometimes think of like Mary Poppins, like we do a little bit for a little while and we don't see people and we never know what's happened, and we hope for the best, and sometimes prepare that the worst might have happened, and then someone will come back in and they look really well, and the things have changed for them, and that is the most amazing thing. It's the most incredible stuff, really. Seeing people's journey. I mean, I've worked there for over 20 years, so I've grown up with a lot of our service users, and I've seen service users working in services now that used to come to our exchange, not just this service but around the country. That is incredible. Like, you're part of someone's journey, so it's a really humbling thing to be part of, really. Using drugs, having sex, are very personal things, aren't you? So you're part of someone's personal life, really. It's huge. So not one story, I think. I can't, but there's too many.
That's good. What about the future? What does the future look like for the health shop?
Oh, we always got fingers in pie, Richard, So I think the Access Project, I think we can do a lot of amazing work. I think work with partners within Clean Slate and NRN and Share Care. I think we've found some different ways of working. I think because we're doing the lane out outreach, and I think we're meeting women where they are. So I think it's about flexibility, diversity, and understanding why someone's not going to come at 9 a.m. if they don't go out to work until 11 o'clock at night. So I see some really positive things that are happening, the way that drugs are prescribed and kind of the innovation that's happening collectively across the services. So that's a big one. Crack, I think services for people that use crack. So moving beyond harm reduction, I love to see, some more work and working in partnership with NRN to look at, the kind of the detox stuff and stuff in psychosocial teams and brief solution-focused kind of work, acts, whether the possibilities are endless, really. I think once we start engaging people in services, then we can start filtering people into other parts as well, I think. So I think stuff around crack would be really interesting. And then health complications, probably. I know that the respiratory incident is amazing here, but seeing what else we could do around that kind of thing with people maybe who can't come or won't come to kind of big services, I think will be really good.
If the podcast had a genie and that you could get granted one wish.
I sound like a bit more space.
All right.
Yeah. I think if we had more space, we could do more things. So that would be beautiful, a space. So, we used to do like acupuncture for people who are going through Hep C treatment or living with HIV. And I think sometimes it's nice to have a choice. So I think people come here, but not everyone wants to come to NRN. And actually, if we could do a little bit more stuff, and then almost like that's what's happened, I think, with the Access Project, it builds bridges into services. It's like that little step, isn't it? So more space would be amazing, because I think we could do loads and loads and loads of stuff, workshops for people around sexual health, around harm reduction, and all sorts of stuff, really. That'd be pretty cool.
You never know if someone's got a spare building somewhere.
I want to leave Broad Street, though.
Okay. Where the health shop is based is in the middle of Hockley on Broad Street, which is like a really cool area of Nottingham City. You got rough trade, you got some wicked shops and cafes and stuff. How come it's there, and like what's the history of it being there?
So it's got a huge history. I think I feel like a custodian. I was saying this earlier today, the health shop, really, because there were lots of people who came before me who did the most incredible work. Like I say, it was set up, I think it was 1984, which is a very long time ago, for one service to be in one place. What was the heart of the gay scene, really. And it had a gay and bisexual men's project, it had a HRD befriending service, there's chill out sound support, which was a recreational drug service, and lots of other bits and bobs to it, really. So it's always been there, always providing support for people from LGBTQ plus communities. It's part of the heritage, really. And there's a person called CJ Barra, and they've written a couple of books around Queen Nottingham, and the health shop's mentioned, I bought the second book last night, the health shop's mentioned quite a few times, really, as being this kind of safe space for people, especially kind of, like I say, around HIV and AIDS, but much more than that, really. And as the Rainbow Quarter is developing, I think that's been kind of formalised this year. I think we're in an approach to see if we want a plaque to like recognise the work, I think, of the health shop as an organisation and service over the years, really, which is, I'm so proud to be part of that experience and that journey, really. Like I say, the staff that came before me, and hope that the staff will come after me. Lots of incredible work, really. So we work with partners, for example, the Law Roberts end of the street. We do testing events down in their basement for the Front Runners, which is an LGBTQ plus running club. We've done loads of stuff in the scene for a long time.
So it really is part of like Nottingham history.
Yeah, it genuinely is. It's awesome, really.
One question we always finish on is anyone working in substance use or harm reduction or areas like that, it's a really hard job. And I always ask, why do you do it?
Oh, gosh, why do I do it? I think personal reasons, I never part of those aside. I think because it's really interesting. I think the people we work with are really, really interesting. I really love my job, like genuinely. I find it very interesting. And there's always something new. There's always something new to learn from people. The health shop is so diverse. Like I say, our service user group is so diverse. There's always something to learn from somebody. There's always something new to try. I think we're lucky the way that we're managed and supported, that we're allowed to try new things, because you can make a change and a difference. And like I say before, that might be really small, but it really matters. Like, everyone really cares. So yeah, I think I would never do anything else now. I don't know what else I'd do. Like, why would I do anything else? It's awesome.
Thanks, Lou. That's been amazing hearing about everything you guys are doing down there. And just thanks for spending a bit of time with us in a very busy day.
No problem. What I would say, if anyone wants to know more about what we do, you can visit. So we do professional visit sessions, and staff are welcome to come and have a look, and we go through things in more detail. But also service users, if someone thinks they might need us, you can just walk in. Like, you don't need to make an appointment, any referral from anybody. The door is open. Our blue door, our famous blue door on Broad Street, apart from Wednesday morning, we are open. You can just walk in and ask for anything. And if we can't help you, we'll try and find someone that can. But there's no appointment needed for most of the services that we provide. Just a friendly face.
Thank you for listening to the Nottingham Recovery Network podcast. If you or someone you know are looking for support with their relationship with drugs and alcohol, we are here to help you. Visit www.nottinghamrecoverynetwork.com for more information.